Hello, everyone, and welcome to our live stream event today. We have an exciting guest with us today, Patricia Davis, who is our Deputy Chief Nurse. She's going to talk to us about the new developments that are coming to the VA Maryland healthcare system. But before we begin, some housekeeping things. No matter where you're watching, if you want to leave a comment in real time, just hit the comment section and we will see it. If you have a question that you want to ask, we will see it and we will be able to answer. Also, from wherever you're watching, please remember to hit the like button, the follow button, the subscribe button, and make sure that we are always on your radar for whenever we have a new live stream. Welcome, Patricia Davis, our Deputy Chief Nurse here at the VA Maryland Healthcare System. We're here to talk about the DAISY Awards. So, can you please tell us what the DAISY Awards are?
All right, so good morning, everyone. And I am certainly excited to be here with you all today to talk about the DAISY Award. The DAISY Award is a way that we can, and our families, as well as our patients and our employees, can recognize a nurse. And this can be a registered nurse, an LPN, or one of our advanced practice nurses who have demonstrated care and compassion, extreme and going above and beyond while that patient was here in our care at VA Maryland. This can be on any of our campuses. The award can be given to an employee at Loch Raven, Perry Point, Baltimore, as well as any of our community-based outpatient clinics. This is an exciting award for us because it gives our patients and their families mainly an opportunity to recognize a nurse and to say thank you again to that nurse for the care and compassion that they have given.
So, I understand that the nursing service is going to have a big launch on Monday of the DAISY Awards. What does the launch mean?
Yes.
What's going to happen at the launch?
So at the launch, this is going to be a time that our rewards and recognition committee members, as well as other nurses, can actually come down into our lobby and welcome our veteran patients coming into VA Maryland Healthcare System and telling them about this award, what it is, and how they can participate in it. This award is available here at VA Maryland. The nomination forms are available on all units and in all areas for their use, for our veterans' use. So this is a kickoff for us. This award had been previously here at VA Maryland back in 2000, about 2015. However, we have re-engaged with the DAISY Foundation and we brought it back to VA Maryland.
That is wonderful news. And I also understand that the DAISY Awards and the DAISY Foundation is kind of like a way to, a quality benchmark. Can you talk
Yes.
about what that means for the quality
Yes.
of nursing?
Right. So what that means for us is that our patients have recognized and or their families have recognized that we have gone above and beyond in the delivery of quality care to our veteran patients. This is basically demonstrated by the nurses or the nurse who was actually taking care of them. So this is very big for us. We are big on quality, making sure that our care delivery is appropriate and also that we are meeting all of our metrics that most patients don't even know that we go above and beyond to ensure that when they leave our hospital, they leave in good state.
So how can nurses or how do nurses uniquely support the needs of veterans, as nurses?
Yes. So they support the needs of our veterans based on individualized care plans that are stood up for that veteran when they come into our care. So this is not only on the inpatient side, but this is also on our outpatient side. So whenever we interact and encounter one of our patients, we look to see how we can improve the quality of that person's life. What are they coming to the healthcare system for? And how can we, as the healthcare system, certainly improve upon whatever the situation, condition may be? A care plan is developed for that individual veteran, and it is individualized. And we basically operate from that to deliver care to that patient.
So basically, puts a highlight on the good work that nurses do already, and sort of inspires them to step up, knowing that any veteran can nominate them for a Daisy Award.
Yes, and we're very happy about this because this award really is an international award. This award is in 39 other countries, as well as here locally in our VA. This award is available in the DC VA, the Huntington VA, Beckley VA, and also our Wilmington VA. And those are VAs that are very close in proximity to us. This award is available at their locations as well. And to date, the Daisy Award have been given to over 210,000 nursing staff. So this is a big deal. It's done at a celebration. First of all, the nominations are submitted by the patients and or their families, or it can be also submitted by peers. So if you recognize that a nurse has gone above and beyond and performed and demonstrated excellence in their care, a coworker or provider can recognize that nurse through a Daisy as well. These Daisy Awards are given at a celebration. So we choose to do a celebration. And for us at VA Maryland, that is basically recognizing our nurses during Nurses Week. Or for us, we shall say Nurses Month.
Yeah. So you told me when we spoke briefly yesterday, you told me a little story about how the Daisy Foundation Awards got started. Maybe
Yes.
our viewers would really like to know that story.
Sure, sure. So the Daisy Award actually started from a family. Patrick Bonds was a patient at a hospital, and he liked having Cinnabons. So he loved having them. He liked the aroma of them. And he was at that time critically very ill. And his family would bring him in Cinnabons, anything to increase his appetite, to encourage him to eat, and also to lift his mood as well. And he wanted them to not only bring them to him, but also to extend to the nursing staff. So then they started bringing Cinnabons to Patrick and also to the nursing staff who at that time were supporting him. After Patrick passed on, his family wanted to do something in his honor. So they actually stood up the foundation, the Daisy Foundation. And they have promoted this, and it has grown. It has taken on very well, and it has grown.
Well, that's a very wonderful way to honor the nurses who do the hands-on care, because doctors come and go. There's a reason why I say I was there as long as a doctor's visit, 5 minutes in and out. But nurses are there 24/7.
Right. Right. The nurses are at the bedside 24/7. And there is something that we say among nurses, that nurses are the ones who actually promote the healing. So the doctors are part of doctors and other staff, other interdisciplinary staff. They are a part of the team, and the team approach that we use for patient care here at this VA. So they are part of the team, and they are actually, the nurses are very instrumental. They're the eyes and ears. They see what's going on with the patient. They can recognize subtle changes and alert the team. We have special teams here, EWS team here at VA Maryland, and that team is for that early recognition of any changes in the patient and action, because we know that when we act early, it makes a difference.
Sure does. It sure does. So, so veterans and their families should be really excited to know that this is a very good way that they could recognize the nurses that gave them quality care.
Yes, and this is an award that we don't have any other award that actually is an award that can be stood up by or can be initiated by a patient, their family, and or their family.
So, how does having the Daisy Awards here? How does it strengthen the culture here at the VA Maryland healthcare system among the clinical teams?
It does. It actually does. For one thing, this award actually given to a nurse, this award actually does improve the camaraderie amongst the staff and also the excitement. The nurses are honored when they're given, this is a big deal to receive one of these awards. So it actually does improve the morale of the nursing staff and also in improving the morale of the team when they see that one of their own has been honored as well and also singled out for the care that they're given.
So, when a nurse receives a Daisy Award, what do they get? Do they get a certificate? Do they get a cup, a trophy? Like, how does that part play out?
Yes. So the Daisy Award here at VA Maryland, the nurses will receive a pin, a lapel pin, and we love pins. And you'll see that our nurses, including myself, we love our pins and we have plenty of them. And you'll see them all attached. Our service pins, you'll see them all attached on our IDs. So they generally will receive a lapel pin.
Wonderful.
And they can certainly proudly wear that. That is one of the ways that we recognize our nurses, in addition to a certificate that they will receive also.
Very nice. So, on Monday, when the nurses are going to be greeting patients, are they going to just be passing out information? And what is
Yes.
the time frame? So, if
So they
patients coming in on Monday want to interact with a nurse from the Daisy team,
yes.
what can they look for? What can they expect?
Well, they can look forward to a staff that will be very, very excited to talk about Daisy. So, in addition to giving our veterans who come in and their families written material, they will also converse with them and tell
Mhm.
them about the award and what that award means to our nursing staff and also how they can engage and how they can initiate the award.
Nice. So, this is something that veterans can sort of take control. We always tell veterans take control of your health, be an advocate. This is a good way to say thank you to the nurse who went above and beyond.
Yes, this is a very good way to say thank you. The nurses are unaware of the nominations when they come in. So the nurses are not aware of the nominations and they will know um, of the nomination shortly or that they have been awarded shortly before the award is given because we want the nurses to also share this with their families. So we do invite the families of the nurses to attend the ceremony as well. Oftentimes, our families are aware of some of what we do. And while we might be um, extraordinary people at home to them, or they might not see us in that frame at home because it's just mom or it's just dad. But when they see the special recognition that your peers and your patients give to them, that is very exciting and for the families as well.
So it sort of gives credence and stock to one's, and weight to one's job or one's life outside the home. Is there anything I did not ask you about the Daisy Awards that you want our veterans and our veterans' families to know?
Well, the one thing that I really want them to know about the award is that the award is here, and we want them to use the nominations as they feel that it is appropriate for them to recognize our staff. we realized that this is a new award, and this is the reason we're doing the campaign, the kickoff, so that the veterans can be aware. We want them to nominate people, our nurses, who they feel that have gone above and beyond. They have to write a story, so they have to write something about what they encountered with this person, and that is sent to the nomination committee, to the committee who actually do the selections. The stories are very good. They're very compelling. I remember looking, and I was very much aware that this was an international award back in 2015 when we brought the award here. When we attended celebrations like conferences, magnet conferences, there was always a segment for Daisy there. Also, on a personal note, one of my sons had a motorcycle accident that was quite traumatic. And this has been probably, now looking back on it, this has probably been about 8 or 9 years ago, but almost seems like yesterday when you think about it. And he was at the University of Virginia. So he was medevac there because he was very close to there when he had his accident. And while I was in the trauma unit, I did with him, I did notice that they had the Daisy. So they had a huge board there recognizing Daisy and also asking for nominations. So I thought that was quite, I was really happy when I saw that, because then I said, oh yeah, this is very real. It's not only at VA Maryland, it is something that is in other states as well. And I knew that it was in some countries, but I did not have the magnitude of how it had grown until we applied this last year for the Daisy again, and to stand that award up again. And then I saw how the Daisy has grown over the years.
Well, that's amazing. And so there's a saying that says the nursing service is the backbone of any medical center. And now patients will be able to nominate their special nurses for the Daisy Award to strengthen that backbone.
Yes, yes, yes. That is quite true. That's what we nurses say, and that's what others say in the community as well. And within not only the profession, but outside of it, that nursing is the backbone of healthcare and of facilities. And again, that's because we are here 24/7, and we are large group. So where you might only have, one or two physicians overseeing the care of a patient, you will have a whole team of nurses who help to provide care, nurses and others within the interdisciplinary community who provide care for that patient as well.
So are we going to be putting a bulletin board of nurses in each unit who've been nominated and who won the Daisy Award, so that patients can see that this is an award-winning group of nurses in their units?
So we will be utilizing our regular boards as well as our virtual boards. So it's a big deal for us. So we definitely want to highlight those nurses who have been nominated or who have received the awards. We do want to highlight them. We do want to let everyone know about them, so that not only will they be congratulated at the time the award has been given, so that their colleagues and also peers can recognize them as well outside of the immediate service area. So we do want these awards to be known, and we want to make sure that everyone is aware of who has received a Daisy, similar to what we do with our certifications. So we always want our nursing staff and everyone else to know when our nurses have received certification, and when departments have received full certification. We always want them to know that, because that is a part of quality, going above and beyond what is required of the nursing staff to receive that designation. It does say something. It says more about the nurse than that they are a registered nurse. They are a registered nurse, and they are board certified. Not only in their regular field field of nursing, but also in the field of practice.
Well, this is a very exciting development for here, us at the VA Maryland Healthcare System. We're looking forward to veterans and family members nominating nurses who've gone above and beyond. And for veterans and family members who come in Monday morning early, I think beginning at 7:30.
Yes. So the nurses will actually, and the team will actually be in the lobby because some of our leadership will be here as well. I'll be there as well. Some other leadership will be there. And it is from 7 o'clock in the morning to 8:30. And that is so that the day shift, as well as our night shift nurses, can also be a part of this.
All right. So do you hear that, veterans and families? Come and join us at 7 o'clock at the Baltimore VA Medical Center lobby and interact with the nurses and get your nomination forms ready in the
Yes.
event that you want to nominate your nurse for a Daisy Award. Thank you, Patricia Davis, for joining us.
Right. So one thing that I failed to talk about is that our nurses and our committee will have a table on the second floor. So
Okay.
for those of you who actually do come to the medical center, and you might not be there at 7:30 in the morning, 7 o'clock in the morning, or at 8:30, but when you're there for your appointment, you can stop by the table that will be on the second floor, and nurses there will be able to talk with you about the Daisy Award, how you can be a part of this a special award, and know that when you nominate someone and they're selected, not only will that nurse and her family be made aware, but you will be made aware as well. And that your nurse was actually selected for the award, and when the award will be given.
Thank you so much. Such exciting news, and also a good way to demonstrate nursing excellence,
Yes.
and also a good way to inspire even increased excellence in nursing
Yes.
for our veteran patients.
And also to share our eye care values and our commitment to excellence in healthcare.
Thank you, Patricia Davis, for joining us. She's a deputy chief nurse of the VA Maryland Healthcare System. We appreciate your time very much. And thank you all for joining us. And we hope to see those Daisy nominations rolling in after Monday. Thank you so much.
Thank you. Thank you.
Bye-bye.
Bye-bye.